Imagine discovering that hundreds of children underwent surgeries by a specialist at a world-renowned hospital, only to find out that critical opportunities to ensure their safety were missed, repeatedly. This is the shocking reality uncovered by a recent investigation into the practices of a surgeon at Addenbrooke's Hospital in Cambridge. But here's where it gets even more unsettling: the hospital trust had been warned years ago, yet failed to act. And this is the part most people miss: it wasn't just one mistake, it was a systemic failure that left families devastated and children in harm's way. The surgeon in question, Kuldeep Store, was suspended earlier this year amid concerns that her surgeries fell below the expected standard. However, the roots of this crisis trace back to 2016, when an external reviewer flagged serious issues in her practice. The hospital trust's failure to act on these recommendations is described in the report as a pivotal missed opportunity. Had they intervened, investigators believe, much of the harm to pediatric orthopedic patients could have been avoided. The investigation, commissioned by Cambridge University Hospital's NHS Foundation Trust, CUH, and conducted by Verita, examined approximately 700 planned and 100 emergency operations performed by Ms. Store, some involving adults. The findings are damning. A series of major and minor oversights by CUH's leadership allowed substandard practices to persist for years. But here's the controversial part: was this the failure of one surgeon, or the failure of an entire system? Rad Seeger, a retired lawyer representing 25 affected families, argues, this was not a rogue surgeon, this was a rogue system. Concerns about Ms. Store's work first surfaced in 2015, yet it wasn't until 2024, after her suspension for personal reasons, that other doctors discovered a higher-than-expected level of complications among her patients. One heartbreaking case involved Darcy, a child whose hip operation left her leg rotated inward at nearly 90 degrees, requiring further surgery. Her parents had feared their concerns were brushed under the rug, and the report suggests they were right. The 2016 external review by Robert Hill, a senior pediatric orthopedic surgeon, identified clear shortcomings in Ms. Store's practice and proposed steps for improvement. Yet, as Mr. Hill later stated, the trust failed to draw the correct conclusions from my report, and demonstrated little if any insight into the issues confronting them. This raises a critical question: how could a hospital of such repute ignore such explicit warnings? The report commends Ms. Store for making efforts to improve her practice independently, but without the trust's support, deficiencies persisted as her caseload grew. Among its recommendations, the report calls for clearer line management, mentoring for new consultants, and reliable record-keeping for future reviews. CUH has accepted the findings and published an action plan, but for many families, the damage is already done. Roland Sinker, CUH's chief executive, apologized and pledged to learn from the report, calling it a pivotal moment to change our hospitals for the better. Meanwhile, the General Medical Council has placed restrictions on Ms. Store, requiring close supervision in all her posts. The Care Quality Commission is also considering regulatory action. But here's the lingering question: could this happen again? While CUH promises change, the case of Ms. Store forces us to confront deeper issues in healthcare oversight. Were the trust's leaders negligent, or was this a systemic blind spot? And what does it take to ensure such failures never occur again? We want to hear from you. Share your thoughts in the comments. Is this an isolated incident, or a symptom of broader issues in medical accountability?